Hi everyone, welcome back. Well, studies have shown that Black and Hispanic people are more likely to develop Alzheimer's disease, and a recent report found that the Alzheimer's Association shows discrimination is a barrier when it comes to dementia care. The Connecticut chapter is holding a dementia education conference next week, and Eme Martin, Health Systems Director with the Alzheimer's Association, talking to us live about this morning. First, thank you so much for joining us today.
Thank you so much for having me.
First, can you give us a little bit more information? Why is it that older Blacks and Hispanics are more likely than whites to develop Alzheimer's?
That's a great question, and it's rooted in a couple of different challenges. Some are related to health, and some a little less directly related to health. In terms of those that are related to physical health, the development of dementia occurs most likely when you're experiencing cardiovascular illnesses such as diabetes, hypertension, and cardiovascular illness or heart disease. And those tend to be more common among African American or Black and Latino populations. In terms of the social factors, there's also a higher propensity of the development of dementia with conditions that are related to stress or discrimination. And those two also tend to be linked to those persons of color.
All right, and so why is it that you think these minority populations are experiencing this kind of discrimination in accessing health care?
That's also a good key question. And it's really rooted in, unfortunately, our history in this country of discrimination and the systems of racism that continue to exist and unfortunately disfavor communities of color. That includes their access to health care. It's also related to the interpersonal relationships that patients and providers have. If there is a perceived discrimination or perceived disconnect between a patient and provider, research studies show that when the racial concordance aligns between patients and providers, that there tends to be more favorable outcomes and more favorable experiences. And so in some ways, when patients of color meet with a provider that does not look like them, they may believe that they won't have a great experience, and it can be a self-fulfilling prophecy in some ways.
All right, so let's work on creating change. What could be done on both sides to help people get the care that they need?
Well, first, it's having these type of conversations, acknowledging that these challenges exist, and then working to make those changes. I'm really excited about the conference that we're holding in Connecticut next week because we're going to focus on acknowledging and understanding these barriers and then working to educate and train around those issues and how to resolve them.
All right, so let's talk about this conference. It's the Dementia Education Care Conference, 3-day event. We're seeing the details there, April 7th through 9th. So how can people get involved and what can they expect?
Absolutely. So the first 2 days of the 3-day conference are focused on our providers of care. And that's our physicians, our social workers, our nurses, our certified nurses assistants, anyone who's touching our patients and families living with dementia. And that's available to them with a small registration fee. The third day is open to the public and caregivers, those who are also in the trenches of caring for loved ones who live with dementia. And there's no registration fee to attend. And both can be accessed through our 1-800 helpline, which is also a service provided 24/7, 3 a.m., 3 p.m., with any challenges you may have. And that's 1-800-272-3900. You can register, learn more about the conference, and learn about our support services, which will also be covered next week.
Wow, so important. Eme Martin, I want to thank you so much for your time today. Alzheimer's and dementia impacts too many families here in Connecticut, and caregivers need the help too. Really appreciate your time and these resources. Thank you.
Thank you.
And we'll be right back.